Hi, my name is Ashka and this is Aden and Manasvi. Welcome to the PNC podcast. Today we have a very special guest. Please welcome esteemed psychiatrist, Dr. David Plevin.
Thank you very much.
Welcome to our studio. How are you today, Dr. Plevin?
Very well, thank you.
So Dr. Plevin, tell us, how did you get into psychiatry and what made you interested in the profession?
Yeah, so I think psychiatry is a very interesting field of medicine. It's a sort of combination of really getting to know people on a personal level. There's a lot of interesting treatments, whether they're medications or brain stimulation treatments. A lot of interesting philosophical questions. So it's a really broad area of medicine, very interesting.
Yeah. So how long have you been a psychiatrist for?
So I got my fellowship in psychiatry at the beginning of last year, and I'd been training as a psychiatrist for the previous 5 years, so working as a doctor, but specifically in psychiatry and training in that profession.
Have you enjoyed most of your years?
Yes, it's a very interesting profession. There's all sorts of, you meet a lot of interesting people. You have to really like people and the opportunity to get to know them. But I really do love what I do. It's a great job.
What do you believe are the biggest challenges for young people in today's society?
That's a good question. I think there are a lot of stressful things in society. Social media is certainly something that has become a stress that, was perhaps beginning to become around when I was in high school, for example. I think that, there are certainly new forms of stress that wouldn't have existed when I was, 20 years ago when I was in high school, for example. Well, actually, that's more than 20 years ago. But I think there's, it's not only, I guess, being aware of mental illness brings its own issues. So I guess there are challenges, and I guess there's a need for young people to, have that resilience as well, which comes with dealing with stresses in life.
Do you believe that drugs are the best way to treat patients when going into mental issues?
That's a really good question. It depends on the particular type of mental health condition, the particular mental illness. For some people, if they're psychotic, which is where they might hallucinate, like see or hear things that aren't there, or they might have unusual beliefs, which we call delusions, medications can be really helpful. But they're not always helpful for everyone. Sometimes people need talk therapies, which psychiatrists are trained in as well. There are other forms of treatment, which would like brain stimulation treatment. So we use electricity for some people, which is called electroconvulsive therapy. Recently, we use a magnetic stimulation called transcranial magnetic stimulation, which can be very helpful for some people with depression. No treatment helps everyone, but all treatments, including medications, can be useful for some people. Medications do have risks of side effects as well, so that's something we really need to be aware of.
Yeah.
What are the most challenging aspects of psychiatry, and how do you maintain a healthy work-life balance?
That's an excellent question. I mean, look, by the nature of a profession where you are dealing with people who are in a lot of distress, people's behaviour can be difficult sometimes. And I mean, I speak to friends, I speak to family, I speak to colleagues for support. I also make sure that I give myself enough time on weekends and evenings where possible, just to not do anything and relax, sleep in, have fun with friends and family.
So you have a Bachelor of Science, Bachelor of Pharmacy, and you're a doctor in medicine. Why did you choose to study these fields, and would you ever go back to study?
Oh, that's a good question. Science, probably, to be honest, because I didn't know what to do after I finished high school. But I did do subjects that led towards pharmacology, so I guess medications and their effects on the body, substances and their effects on the body. I then wanted to do something with people, so I went into pharmacy instead, and I wanted to go a bit further than that, so I did medicine. I am actually doing some further study, so I'm doing a PhD in one of those treatments that I discussed, the magnetic stimulation, so having a look at that and how we might work out who benefits from that treatment and who doesn't benefit from that treatment.
We read a research article you wrote discussing the neuropsychiatric effects of vitamin C deficiency. What noticeable benefits are there for us to increase our daily vitamin C intake?
That's a good question. I think probably for For most people, I mean, assuming you're eating fresh fruit and vegetables, you're probably not going to run into any problems. But I guess one thing I learned when I wrote that paper is that, first of all, there are a lot of people who obviously don't eat enough fruit and vegetables, and that can have effects not just on their brain and their emotions and memory and so on, but it might have effect on their wound healing, for example. If they've got a wound, and it might delay how long it takes for that wound to heal. I guess it's also very interesting to know that vitamin C, it doesn't last in fruit for very long, so I think it sort of degrades. So it is important to eat fresh fruit and vegetables. Look, I think if you're eating normally, you're unlikely to be at any risk. So keep doing what you're doing.
Yeah.
And also, if any young children or people want to get into psychiatry, do you think that it would be a good career, and would you support them?
Oh, absolutely. I think you'd have to do a medical degree first, and then there are many areas of medicine. And if you're someone who likes talking to people, and you like getting to know people's stories, then psychiatry can be a really good option. So I'd absolutely support them.
And also, what is your advice for young people navigating through the world?
I think spend time with friends and family. I think don't put too much pressure on yourself to, achieve, whether it's academically or sports. I mean, obviously, doing well is good, but not putting so much pressure that you become too distressed that you can't tolerate things. Being brave. I mean, there are a lot of things that do cause us stress and anxiety in the world. It's not saying you need to do silly things like wrestle a tiger or something, but I guess there are things that can be scary, and it's good to face our fears. I think, because a lot of people, young people or adults or even elderly people, they don't face their fears, and this can lead to a lot of problems. And talking to people, I mean, I think it's really important, even outside of psychiatry or anything. Just have a good support network around you. Find things that are meaningful and valuable to you.
Thank you so much for joining us,
My pleasure.
Dr. Plevin. We really enjoyed your insight, and thanks for being part of our PNC podcast. Take care.
Thank you very much.
Bye.
Bye.
Thank you.
Bye.
Thanks.